just about everyone, so we'll go and get started. So I will call this meeting of the El Paso County Public Health Department Board of Health to order. It is 8:31 on January 28th, and we will start with roll call. Vice President Salt.
Here.
Commissioner Geithner.
Here.
Commissioner Nelson.
Here.
Mayor Dixon.
Here.
Councilman Donaldson.
Here.
Dr. Chan is online. Dr. Chan, can you hear us?
Yes, I can.
Great. Mrs. Ralston
Here.
and Dr. Vu? Not yet. Okay, moving on to approval of the agenda. I need a motion and a second, please.
Mayor Dixon, I'll move to approve.
Second.
First Ralston, I second.
All in favor?
Aye.
Aye.
All opposed? Okay, motion passes. Moving on to Board of Health comments. I will take the privilege of going first and just say it's great to see everyone back after the holidays. I hope you had a wonderful end of year with your family and friends. We were just talking about the crazy weather of this winter. I don't know about you, but I was out in the backyard on Christmas Day throwing the football with my boys. So hopefully you all had a similar experience if you were here locally. The second thing, I just want to thank the staff, Deanne. I've had the pleasure of going to a couple events that happen around that time of the year. So the first was the holiday party, very well attended. Chipotle for lunch brings the people out. So thank you for that. I do want to give a shout out to Vice President Salt and Mayor Dixon for also attending. And we got to have some really great conversations with several folks, but I wanted to call out Emily and Kayla, who are registered dietitians in the WIC program, of all programs. We were kind of tickled to get to sit across from them, Vice President Salt and I, just given the conversations in this room that we've had over the past several meetings. And I can tell you the passion and the just enjoyment for what they do was so clear and so evident. You have some really great people. So that came through. I told them to watch this to hear their shout out. So we'll see if they did. And then just the second thing, and then we can go around the room. I also had the pleasure and honor to be a part of the award ceremony for service recognition. So we gave out certificates for 5, 10, 15, and 20 years of service. So it was a lovely event at the Pinery. I'd never been up there. Highly recommend it. Again, Mayor Dixon and Vice President Salt were there with me, and it was a really nice event. So thank you for putting that on, and to everyone who was a part of planning it. I'm sorry. And then I have a third thing, which is I don't know how this escaped the board, but at that service recognition ceremony, our very own Deanne celebrated 10 years, and so we wanted to spend just a couple minutes highlighting and further recognition. So we have some flowers for you, Deanne.
Thank you.
So it goes without saying, but I'll say it again, just to reiterate what we talked about last meeting. Thank you for everything.
Thank you.
Crazy year. But hopefully it was very rewarding given just what you've been able to accomplish and what you've been able to lead the team through. So on behalf of the entire board, thank you and congratulations on 10 years.
Thank you. And I appreciate the recognition for the 10 years of service, and I appreciate the board for your support during what has been a very unique year. And also, that years of service celebration is truly such a joy because we get to recognize our team here at Public Health. And as you know, from attending the holiday luncheon as well as seeing our staff here at our board meetings. We have a phenomenal team, and I'm grateful to be a part of this team in public health in El Paso County. So thank you.
Great. We'll now go around the horn, and just for the record, Dr. Vu is here. So do you want to kick us off?
No comment today. Thank you.
Okay. Mayor Dixon.
So there are a lot of states that seem to be under the microscope from the federal government. And I'm hoping that El Paso County can be a shining example of zero issues, should that happen to us. And if you need any kind of help or anything, holler.
Thank you. Commissioner Geithner.
I'll just say thank you for your 10 years of service. It's we're really grateful to have you here. And outside of that, I just will say thank you for being so promptly on top of the new dietary guidelines and putting that on the agenda today. I'm really looking forward to that presentation.
Well, a lot. I've gotten to do a lot the last month and a half. We did the holiday party, which was fantastic, the Years of Service Awards, which was a lot of fun. And then I got to tour clinical services in the lab last week, and I tried to take notes of who everyone was and what they did, like discreetly, because I was so engaged. But like the passion that everyone has for their job, I have never heard so many people say, oh, I could talk about this all day. And it's such a specific thing, like TB. Not to pick on Aaron, but, it was just, it was so great to really see like the impact of what we do. And when we're discussing, regulations and policies and grants and what does that mean, but getting to actually meet the people doing the work and seeing the rooms and the equipment and hearing their passion, it was so encouraging and made it more exciting to show up and do the work we do here. So you have a great team here, Deanne, the really incredible staff, and I look forward to continuing to meet more of the different people in different divisions. So thank you for taking the time with me, Summer and Janelle. I really appreciate it.
Great. Did you want to add anything else?
No.
Okay. Commissioner Donaldson.
Yeah, thank you. And Deanne, I'll take the opportunity also to thank you for your service to public health and the citizens of the county. And I wish I could have been at the ceremony or the event when everybody was recognized for 5, 10, or 15 years. There was a conflict with a lobbyist call, and it's important to keep an eye on the legislature right now. We're not safe. They're back in session, so I wasn't able to make it. But, yeah, sincerely, thank you very much.
Thank you. Commissioner Nelson.
Good morning. Just want to echo my gratitude for your service and leadership over this past year, stepping into a difficult situation and a lot of change that has taken place even before I got on this board, but even since. And so that is a big challenge that you've managed, and so grateful for your leadership during that time, and excited to see where we go in the next coming months. And just thankful for everyone that serves our community, and I'm jealous of the tour Miss Salt got. So my schedule is jam-packed, but I will try and make some time because that sounds wonderful to get a better understanding of the work that we do down on the ground level. And so I really enjoyed my tour of the septic systems across different parts of the county. I know that's crazy to say, but it just is really interesting to learn about the different aspects of how our Department of Health serves our community. And it's so important, really important work. And so I look forward to continuing to learn more in this coming year. And that's all I got.
Great. Mrs. Ralston.
Just echo everything that's been said about Deanne and her team. We've got a fantastic team here at El Paso County Public Health, and I certainly appreciate all the work that you do every day for the public's health, and hope you had a good holiday, and I know you're back ready, hitting the ground.
Okay, thank you. Moving on to approval of the minutes, I need a motion and a second, and I believe there is an edit that we need to make. So do we have a motion?
So
And then
moved.
we added it during.
like to hear the edit.
Just one small minor change. In the minutes, it lists that Commissioner Geithner was the one who nominated me for vice president, but it was actually Commissioner Nelson. So that was the only correction I had. And with
Okay.
that, I move to vote to approve the minutes with that amendment, that adjustment.
Mayor Dixon, I'll second.
All those in favor?
Aye.
All opposed? Great. Motion passes. We will now move on to public comment. Do we have anyone online or in the room? Okay. So now we'll move on to item 6. We have a proclamation recognizing the retirement of Devi Almkamov. So I have just a little intro, and then we will read the proclamation into the record. So during Devi's 18 years with the El Paso County Public Health Department, she has supported the previous iteration of the breast and cervical program, Nurse Family Partnership and Reproductive Health Clinic, and the Communicable Disease Program. She made a positive and lasting impression in her roles, which you'll hear more about as Senior County Attorney Lori Seago reads the proclamation. And I have it right here if you would like to read it.
I know, this is just a suggestion, if you don't mind. I know that kind of in this board, I have seen that the county attorney has read these. I don't know if that's in our rules or not, but most of the other boards that I'm on, usually a member of the board reads it. Not that Ms. Seago won't do a lovely job, but it's a bit odd from what I've seen to have the attorney do it. I don't know how that practice got started. So I'm just going to throw out there, since this is the first one of the year, that if that's not somewhere in our rules, that perhaps we do want to have a board member make the motion and read it. Just
I'm certainly fine with that if you
It's
have no
not
worries.
in the rules that the attorney read it. I'm happy to do it if you would like me to. If not, that's fine too.
Let's set a new precedent. I like that. Thank you for your suggestion. So why don't we have a motion and then we move into the discussion and I can read it into the record? Is that the practice, or should I read it now?
Generally, what we do at the Board of County Commissioners is for the motion maker to read it. So you would say something like, I move to adopt the following proclamation, and then you would read it into the record. And then
Okay.
there would be a second, and then the discussion.
Okay. Well then,
May we call Debbie up?
yes. Debbie, can you please come up to the front, since you were the star of the moment? Okay. Well, as board president, I will have the honor of moving to adopt this proclamation, which I will now read for the record. This is the proclamation recognizing the retirement of Debbie Alkmov, El Paso County by the El Paso County Board of Health. Whereas Debbie Alkmov began her career with El Paso County Public Health as a part-time administrative specialist with the breast and cervical program before becoming a full-time employee with Nurse Family Partnership and the Reproductive Health Clinic. She transitioned to the Communicable Disease Program in 2015, where she has served the majority of her career within public health. And whereas during her time with public health, Debbie has supported various programs resulting in positive impact, such as improving Medicaid billing processes, serving on the Strategic National Stockpile Team, and participating in multiple mass vaccination efforts for both meningitis and influenza H1N1. And whereas through the COVID-19 pandemic, Debbie served within the incident command structure, creating communication systems for internal tracking, which provided clarity and stability for a large team. And whereas Debbie served as a mentor to staff, providing training, support, and guidance and customer service and communication, along with the best brownies. And whereas Debbie's commitment to compassion, kindness, and community service has created a strong foundation that will have lasting impact on the Communicable Disease Program and public health. Now, therefore, the El Paso County Board of Health hereby proclaims its gratitude to Debbie Alkmov for her 18 years of service to El Paso County and wishes her the best in retirement. So we have a motion. Is there a second?
Mayor Dixon, I'll second.
So we have moved and seconded, and all those in favor, say aye.
Aye.
Aye. All those opposed? And adopted by the El Paso County Board of Health at this meeting held January 8th, 2026 in Colorado Springs, Colorado. So why don't we give Debbie a round of applause? Thank you.
Thank you.
You have our gratitude and our thanks. Would you like to have the floor for some words?
I just want to say this has been the best job. I've loved it in public health, and I'm going to miss it. So thank you. Appreciate you guys.
Thank you.
Hey, Mr. President,
Councilman
are you
Donaldson,
going to take
yes.
comments? Yeah. Debbie, I want to say thank you also for your, again, your commitment to public health and really the citizens of the county. And you look much too young to be retiring. So I wonder if you can share anything about what you plan to do in the future.
Well, I take care of my mother-in-law, and they live with me. They both have dementia, so that was the reason for the retirement this soon. And I'll be doing that for now.
So
And
you're
then one day when they don't need me, I'll be traveling and hanging out with my children and grandchildren.
Well, I'll just say I have you're a kind person and a good daughter, and I did that with my father. He had Alzheimer's, and I spent several years after I retired from the Army really taking care of my dad. So God bless you for that, and
So
thank
you
you
know,
again
yeah.
for your service.
Thank you.
And if anyone here in the room would like to share any words or any comments, now would be the time to do so. Yes.
Good morning. My name is Haley Zachary. I am the Communicable Disease Program Manager and have had the pleasure of being Debbie's supervisor for the last 5 years and coworker for the last 10. But Debbie welcomed me into the Communicable Disease Program 10 years ago, as she's done for so many of her fellow colleagues and staff. During that time, she served as our administrative specialist, steadfastly ensuring that our program has remained timely and dependable. She's shared her skill sets of communication, organization, and reliability while pushing us to get through every day, week, and year. Although Debbie has been dependable and a professional employee, her true strengths rely on her positivity, her empathy, and her sheer ability to win people over. She has uplifted our program by never underestimating the value of kindness, for offering a silver lining to every dark cloud and modeling that anything is possible when you have the right people, and always bringing warmth and welcome, usually with brownies. Debbie's faith lies within her service, her family, friends, and the mission of public health. She has served our program and agency with conviction and trust for almost 20 years and will be dearly missed. We wish her the best on her next leg of her journey, and wherever she lands, we hope there will be dessert. Thank you.
Thank you.
If it's not brownies, what's your next go-to?
I just like to bake.
Okay, so anything,
I'm
okay.
willing to try anything, but
Sounds good.
Haley particularly likes my brownies.
Okay. Well, it's tradition to take a photo with you and your proclamation with the board, so
Okay.
we will pause and do that right now.
Okay.
Could we do the photo on that logoed wall over here?
Sure. Okay, so we can move on. Typically, we would have the financial report right now, but because of the fiscal year transition and closeout, we will have that next month. So just FYI, this is fairly typical for this time of year. So we didn't forget, it's intentional. Okay, so now we're moving on to item number 7, new business. We have 3 items. The first, updated dietary guidelines. So Melissa Gordon will lead us through a presentation.
Okay, all right. It's always the hardest part is the clickers. All right, good morning, everyone. My name is Melissa Gordon. I'm the division manager for WIC. I'm also a registered dietitian, so I'm really excited today to be able to talk to you about the updated dietary guidelines that came out earlier in January. All right, we'll see. Okay, I first just wanted to start out with kind of a brief history of the dietary guidelines, what they are, how we got here. So the first dietary guidelines, kind of as the document we know it, was first released in 1980. So we have that kind of image there, a little snapshot of that, all the way through the guidelines that were recently released, kind of at the beginning of January, and with those visual icons. The dietary guidelines are published approximately every 5 years. It is a joint effort document through the United States Department of Agriculture, or USDA, and Health and Human Services, or HHS. So as you can imagine, there's lots of different ways we can kind of look at these guidelines. So agriculture, industry, food, nutrition, health. I'm primarily going to be focusing today with nutrition and health. And the document was mostly originally created as kind of to inform public health policy and those like large meal type of food programs. So school food, WIC, SNAP, other childhood and adult nutrition programs, military veteran meals. That being said, we all know there is consumer guidance that also comes out with it. And historically, there's been a scientific committee. They do a big long report with a full scientific review of the current evidence. They release that report, there's public comment, and then it all kind of turns into dietary guidelines. There's often multiple documents that come out with the dietary guidelines, so sometimes a longer form version that's mainly used for public health professionals, doctors, dietitians, things like that, and then a shorter consumer one. This new one that came out towards the start of January both followed that and diverged a little bit. So there was an original scientific report done in 2024, public comment, and then when these dietary guidelines came out at the start of 2025, there was another kind of new scientific review that was done with it and released at the same time. There is a consumer-facing website, around a 10-page document, and then that scientific report and scientific appendices. There are varying estimates on percentages, but I do feel pretty confident in saying that the vast majority of Americans do not fully meet these guidelines when it comes to their individual eating, and that is either due to overconsumption in some categories or underconsumption in other categories. For example, estimates are around only 10 to 12% of Americans eat enough fruits and vegetables with that regard to that guideline. And then just for the visual guidelines, for those of you who are visual people, we had the My Plate visual icon. That was the most recent one that we had from 2011, eked into 2026, and then the new food pyramid visual icon also came out in that first week of January. Obviously, kind of big differences between these two visual icons. So My Plate was really based off of, we eat off of plates, gave kind of those plate percentages, so to speak, of around what a plate should look like, whereas the new visual icon has protein, dairy, and fats, and fruits and vegetables kind of in one category, with whole grains smaller at the bottom. And as well, there isn't as much, I would say, amount emphasis on it. There might be as well some more information. These are new. So, you know, My Plate had a pretty robust website where even consumers could go on, play around with it, things like that. That has not come out yet with the new food pyramid, but of course we're still within the same month that they were released, so that might change. So the other thing with the images, you know, obviously kind of big differences. My Plate also had some accompanying images that had the different foods in those categories, where the new food pyramid visual icon shows all those different foods. What is also getting a lot of attention about this is there is a seeming emphasis kind of in that one corner with regards to animal-based protein. So just some deviations with the visual icon, but there was a lot that remained the same. So emphasis on nutrient-dense whole foods. So we saw that a lot. And when I say old guidelines, there was the 2020 to 2025 guidelines. The ones we have now are 2025 to 2030. So both had an emphasis on nutrient-dense whole foods, an emphasis on fruits and vegetables, around 5 servings a day. These current guidelines emphasize vegetables slightly more. It's like a 3 to 2 serving ratio. Saturated fats not to exceed 10% of our total calories. So this was consistent between the two dietary guidelines. I'll get into a little bit more about the fats because we did see some changes there, but that overall recommendation stayed the same, and that's most likely due to some pretty robust research around the cardiovascular impacts of saturated fat. And then the life cycle changes type of thing with regards to nutrition was pretty consistent between the two. Of particular interest to myself and WIC, our guidance around pregnancy and infant nutrition largely remained consistent. So things like some increased nutrient requirements during pregnancy, recommendations for breastfeeding for infants, early allergen introduction for infants, and then just frequent and early introduction of whole nutrient-dense foods for our infants and toddlers, knowing that it's sometimes going to take us repeated exposures until they accept the new food. Consuming a variety of protein foods. So despite the visual icon kind of emphasizing what we might consider animal protein, in the actual guidelines, it does mention things like beans, peas, lentils, soy, nuts. So that is in there and pretty consistent to past guidelines. Some changes with protein too, which I will get into in the next slides. Hydration to focus on water and unsweetened beverages. So again, pretty consistent between the last guidelines and these guidelines. And then portion sizes and eating the right amounts of food for you. So there's lots of different factors about what an individual should be eating and kind of the exact amounts and things like that. And these dietary guidelines, inconsistent with the last, really mentioned this is not a prescriptive diet. It's kind of that overall general guidance. There was a lot of changes though. And I'm also just going to go through some considerations as we think about these changes, in the overall nutrition space. So previous guidelines had said half your grains whole, and these guidelines really went to all whole grains and less overall grains. Overall, this recommendation, most Americans overconsume refined grains and underconsume whole grains. And whole grains are really great for fiber, so kind of as we move more towards whole grains, that's overall a positive change. One of the main considerations here is in 1998, the Food and Drug Administration started mandatory folic acid fortification in enriched grains. So for those of you who may not be familiar, folic acid helps prevent neural tube defects, and neural tube defects can occur very early in pregnancy before someone knows that they're pregnant and could start taking those prenatal vitamins. So this is just something to be mindful of in our overall, diets, is that mandatory, the folic acid fortification, it can happen in whole grains, but it's only mandatory in enriched grains. So the last dietary guidelines had mentioned for individuals getting all whole grains, just making sure some of them are fortified with folic acid, or just ensuring that folic acid intake was enough if you could get pregnant. And then the protein did increase, and the recommendation was displayed a little bit differently than we've seen in the past. So the recommendation is 1.2 to 1.6 grams per kilogram of body weight. This is what I would kind of consider a clinical way to write this. So grams per kilogram might be challenging for some, challenging for some Americans to know what that really means to them. It also did increase from the dietary reference intake of 0.8 grams per kilogram of body weight. So that grams per kilogram of body weight is something that we would use in clinical settings or as dietitians. I would say while it did increase from what we call the DRI, there's another measure that we use called acceptable macronutrient distribution range, and that is 10 to 35% of adults' calories should come from protein. Someone could be eating that grams per kilogram and still be in that acceptable macronutrient distribution range. The other thing to consider here is that most Americans were consuming above 0.8 grams per kilogram. So, as dietitians or nutrition educators, I wouldn't want someone to automatically think, oh, I need to double my protein intake, because most likely their protein intake was kind of above that DRI anyway. As I mentioned, the guidelines did write out those different types of proteins, but there was a removal of protein subgrouping. So in past dietary guidelines, there was weekly intake recommendations around both animal and plant-based sources. This one just kind of had an overall protein recommendation. And then I grouped the dairy and some other healthy fat things together because the main consideration is around saturated fat. So there was a big shift from low-fat and fat-free dairy to full-fat dairy, so things like whole milk. And there is some inconclusive research regarding whole milk and full-fat dairy. It's very likely that full-fat dairy can fit into an overall healthy eating pattern. The main consideration here is that the serving stayed the same. And so when we think about saturated fat, and whole-fat dairy, there is saturated fat in it. And then they did mention that things like butter and beef tallow could be included as healthy fat options, which are also both high in saturated fat. And then animal protein is also going to be higher in saturated fat than some of our other plant-based protein sources. It might be difficult to stay within that 10% of calories from saturated fat when you consider butter, beef tallow, full-fat dairy, and a higher intake of animal protein. So again, something to be mindful of and just to consider. And then we also saw some pretty big changes with regards to sugar. So I'm going to start with children. So the recommendation in past dietary guidelines was no added sugar for 2 years old and above. This one bumped that up to no added sugar for 10 years and younger. And I'm sorry, the past dietary guidelines was 2 years and under. This one is 10 years and younger. Sorry for that. And this could lead to positive change, right? Like less sugar, less added sugar. No one was recommending large amounts of added sugar in the past. So this could be a beneficial change. I think something to be mindful of too is just how difficult this could be in our current food environment. So when we think about both like school foods or even WIC or really any type of nutrition program, not only is there going to probably be a lack of food items on the market, we also really, when we think about childhood nutrition, want to be mindful of both what they're eating, but then also kind of how they're eating it, the food environment that they're eating. And there is some research that overly restrictive meal patterns or environments with children can also lead to some not as desirable health impacts. So just something to, again, consider with that one. Oh, sorry, wrong direction. And then just for sugars and adults, so past dietary guidelines, again, really emphasize nutrient dense, minimize the added sugar. I would say this one strengthen that a little bit to really be recommending no added sugar or non-nutritive sweeteners. But if you were going to be adding them into your diet or eating them. It changed from the last dietary guidelines. We saw that no more than 10% of your calories should be from sugar, so similar to that fat recommendation. This one changed it to grams per meals and snacks. So again, when we think about, meal settings type of thing and industry, this could be an easier benchmark for them to think through rather than calories per in an overall intake for an individual. When we think about it from the individual consumption, though, it could really lead to varying intakes based off of the meals and snacks, how many snacks and how many meals are we consuming. That being said, most likely the recommendation is just a little bit shy if we think about, the general pattern of 3 meals and 2 snacks. So while the sugar recommendations got a little bit stricter, the alcohol recommendation is seen to have been weakened. So we moved from kind of those firmer benchmarks to consume less alcohol for better health. While that statement is true, it's difficult to really implement without firm recommendations or knowing where someone is starting. So just, again, something to be mindful of. We don't often see alcohol in, the public health programming that has or feeding programs or congregate meals or things like that. But again, when we think about individual diet guidance, consuming less of something or consuming more can sometimes be, again, just a little bit difficult to implement. And then finally, highly processed foods was specifically named. And this was really an exciting development. It really isn't going to change our nutrition education. Again, we were always emphasizing nutrient-dense foods. Highly processed foods often are kind of in that more refined packaged snack category or packaged dessert, higher in saturated fat, sugar, or sodium. That being said, again, when we think about kind of how this might inform public health programming or different meal settings, a definition might be needed for actual change in the market and industry. That being said, that was acknowledged in one of the scientific reviews that the definition that often is currently used is ultra-processed foods, and that kind of framework sometimes miscategorizes certain foods. So I believe there is some work being done, again, at a federal level to get a definition kind of hammered out. So exciting to see that really included so specifically, and also to be seen what changes with regards to that. So overall, where does this leave us? I think that remains to be seen. As I mentioned at the start of the presentation, most people aren't following them altogether. I think there has, though, been already some changes in school foods. So whole milk has already been kind of introduced in alongside of low fat and skim milk. And then there is also some federal discussion around retailers that accept SNAP and some of those perishable food categories and some stocking requirements. As for WIC, we don't, the dietary guidelines, while it informs our work, it's not a direct food package change. So there's a whole other process with regards to our food package. A lot of the food package really wouldn't change. A lot of our food is already meeting a lot of these requirements. If we were to truly adhere to it, similar to some other nutrition programs, we would probably see some changes in our cereal and our yogurt and dairy offerings. But otherwise, our nutrition education, again, a lot of it is very similar, nutrient-dense, whole foods, and helping people make those diet changes. Overall, I think we all can be really excited at the fact that there is now so much attention and excitement and knowledge really around the nutrition, and hopefully that starts to lead to some more closer adherence to the guidelines and some nutrient-dense food choices and healthy behavior change in our population. And I can now take questions.
Great. Thank you, Melissa. That was really nicely done.
Thank you.
Any questions or comments from the board? Mayor Dixon.
This is very similar to what my doctor from about 6 or 7 years ago was saying. So yeah, it reinforces what she was trying to push us towards.
Great. Vice President Salt.
I just want to say thank you for bringing this. The comparisons, I mean, I'd read the stuff online a little bit, and then when I saw your slides and it was kind of like, what's the same and what's different, I was like, oh, and then it kind of gave me some fresh eyes to look at it with. And it does seem like they're anticipating a lot more updates on some of the details, like the 10% of the saturated fats and the different allocations of the macronutrients and stuff. So I did notice that when I went back after reading your presentation, some of those things. So I really love the way that you laid it out. I'm excited to see what kind of changes happen, especially as we talk about chronic disease. Like, there's big implications there. But also, I think it was really great talking to some of your gals from WIC that they were explaining to us just kind of like, well, just because your package says you can have this much doesn't mean you have to have this much.
Yeah,
and like really explaining the process in more detail than we can get to in a meeting. And so hearing how they work, hearing this presentation and what you're seeing, I'm just very excited for, just some good, healthy guidelines. And I brought this to my own kids and was like, okay, we focus on eating ingredients, not eating things with ingredients, and having more things that are ingredients. So then they ask questions, and then my daughter got into a fight with me, she's 4, that peanut butter doesn't have protein. And I said, it does have protein. And they're now, my boys have set a challenge of like having protein at every meal. But then it's making them think about what they're eating. And so and these are like, in a lot of ways, simple ways to think about it. And so I thank you for doing this.
Thank you.
Yeah, thank you for the presentation. I had kind of a similar thought. I graduated in 2007 with a degree in food science and nutrition, and I went more down the food science focus than the nutrition, but I did take some nutrition classes, and all of this seems very common sense, and yet it's taken this much time for the changes to happen with the food pyramid and for it to be federally and publicly put out there for people to understand that this is a healthier way to consume our energy, because that's at the end of the day what this is about. And trying to help my own kids understand, yeah, candy tastes good, but your body doesn't need anything in that candy. Like, there's no value, no nutritional value, the minerals and vitamins that your body needs to operate. And so just, I think the why also is important. And as we at Public Health start to try and, I don't know if there's a plan to spread this out into our community, and I'm thinking about schools and their lunches that they're providing and breakfast, and if it's just a pastry and has sugar in it, and then a yogurt that has lots of sugar, just like encouraging kind of a shift. And there may be some additional costs, because fresh produce, protein can be a little bit more expensive because it's perishable. And, but it's really important that we're giving our bodies the actual nutrients that they're needing. And I love seeing, you know, the avocado right there in the middle because those good fats, those mono and unsaturated fats, or the, you know, omega-3s, are really good for your brain and your eyes, and just those kinds of things, like teaching my own children, like, oh, what I put in my mouth affects how my eyes are functioning or my brain is functioning. And I think connecting it could be really helpful if we're thinking about doing some kind of a campaign to help inform our own community of directly the impact to your own body. I say all of this, and I do not eat that well myself at times. Like, I'm thinking about what I ate yesterday, and I'm like, yeah, I didn't have a single fruit or vegetable. I had French fries, and like, but it's, you know, do as I say, not as I do.
Councilman Donaldson, did you have something to say?
Yeah. Melissa, you know, one of the things you touched on, no added sugar is in here, and then you said that but overly restrictive guidelines can lead to less than ideal outcomes. There's some studies that say that in children. Is it just low weights? Is that what happens with these overly restrictive?
Not always. It's actually sometimes more the other way, and I can look more into the research if that's of interest. We also think about, like, I mean, and this might sound, but like your relationship with food. So sometimes if we're overly restrictive as children, that could lead to, you know, disordered eating patterns in the future, or things like that. And also just like the social, you know, if you think of your own kids and they're at a birthday party and there's an adult telling them you cannot eat with your friends because we're doing no added sugar, you know, the kind of implications there. So yeah, I'm sure there is a happy medium. And it also comes down to, you know, what is our social norms as a society and how can we help shift those where, you know, maybe there is some middle ground too. Yeah.
So we'll go back to the Greek ideal of all things in moderation.
Yes, I think that is.
And so unfortunately for Debbie, no more brownies at work, is what I'm hearing. No, I'm kidding.
Moderation?
Oh, yeah.
It looks like, Dr. Chan, did you have some comments? Go ahead.
I have some questions.
Go ahead.
So when you look at the dietary guidelines in the graphic, it's very easy to see what the proportions of foods and nutrition food groups should be. But I feel that the biggest problem facing Americans is overconsumption. And I know that in the guidelines, people are advised to eat what their caloric requirements are, but both at an institutional level and at a personal level, what are the guidelines, and are there graphics that makes it easily understandable when somebody is overeating or being overserved? And also within institutions like in school lunches, do school lunches calculate calories for the kids?
Yeah, so I would say school foods is not necessarily my area of expertise, but I do know that they follow a pretty robust set of guidelines because there is that USDA reimbursement for their meals. So I can't speak to exactly what those guidelines are, but I do know that they exist. And then when I think your other question was resources around calculating portion sizes and calories, that's right for you? Was that your other question?
Right. I think that there's a very skewed view of what people think a portion size should be, especially when it's based on, say, eating out or something like that. The portion sizes are basically the entire caloric requirement for a day in one meal, if not more. And I have noticed that both patients, friends, and family within the United States have a very skewed view of what a normal portion is.
Yeah, so I would say these guidelines and most guidelines generally go based off of a 2,000 calorie diet. The calories that are right for you are going to have so many different variations, right? Your body size, activity, disease state, wound healing, that type of thing. So there is, outside of the guidelines, but on the same website, there's almost a chart that lists out different caloric levels with the different servings of each food groups, and it does list some serving equivalents too. And again, this might be something that comes out as more materials are developed alongside of this. My Plate, I think, was a good example of, there was a pretty robust consumer website that had different factors that you could put in and showed like what a serving size was or an ounce equivalent or things like that. But I would say overall the guidelines more lays out kind of a in serving sizes, but it doesn't always directly say the amount of serving size. These guidelines do have kind of that other document that goes along with it. And that's really where we often are encouraging people to seek out evidence-based resources, work with dietitians, nutrition educators, really trying to figure out the best meal pattern and amounts for the individual too.
Yeah, I think that with the GLP weight loss medications, I read that the purchase of food, like groceries, has actually gone down because people simply are now eating to their caloric requirements for the optimal weight. So unfortunately, I don't think that that has resulted in a conscious recognition of what the difference really is between the way people ate themselves into obesity and then are currently eating at a lower weight. The other question I have about the guidelines regards food preparation style and what constitutes a fruit or vegetable. Um, I think that, as an example, a lot of people think ketchup is a vegetable, or I'm from the deep south, and something that's very popular that starts as a whole food are um, fried green tomatoes. So, are there any guidelines regarding food preparation style?
Yes, this one does mention as well, and something actually I really liked in this one was, and it's even on the graphic, they did include things like frozen vegetables, canned vegetables, and fruit without, not canned in syrup or not canned in a salt-based sauce. So whole frozen, canned, even dried fruit can be okay as well. And then it also did mention things like grilling and sautéing over frying and whatnot. So it is mentioned kind of throughout the document of those different things. And again, just a really pretty big emphasis, and I would say, which is not completely new either, on that like whole nutrient-dense food choices. But yeah, you bring up a great point, and that is something that on this image, having canned and frozen and fresh, I think is also just a really practical thing for individuals who, even when we think about eating seasonally for costs and whatnot, that can be a good option.
Right. Thank you so much for this presentation.
Thank you, Dr. Chan. Commissioner Geithner?
Thanks. I just want to say thank you as well. This is so exciting to see, and just hearing some of the conversation, hearing like, this is what my doctor's been telling me for 6 years. This is what I learned in school a long time ago. I think government moves slowly. There's good reason for that. But I think to Vice President Salt's comments about, I assume that we're going to see a lot more research done and trying to push forward into newer of this research. I'm really excited to see that because I know just from, the reading and research that I do, that there's a lot more out there that we're still not really capturing yet and talking about. And I not my expertise, but I certainly take, many of the cutting edge professors and things that I follow as good people to talk about what's happening in research, modern day research today, especially around chronic disease, diabetes in particular. And I want to say that one of the things that I'm really, really looking forward to is I know they haven't adjusted that percentage on fat and understanding and thinking about calories and all of those things, but there's a huge emphasis that I'm seeing in a lot of research around satiety and the importance of fat in for that role.
Yes.
And so when we talk about overconsumption and those things, and just it's not all black and white on the page. That the body is such a complex thing. You have hormones that change the way your body processes calories, and so it's not just calories in, calories out. That's a very outdated way of looking at what happens in our bodies and how our bodies utilize the calories that are given to us. So I expect we'll see a lot more. And along those lines, I wanted to say thank you to Deanne for, I know, making a connection with the HHS regional administrator, who I think will be a great resource moving forward. It sounds like you're establishing a great relationship there, because I think as we move through all of this, that she can be a great resource and connection to us through the federal government, even though sometimes it takes a long time for that stuff to hit us. So hopefully we'll get some heads up from her on the things that are coming our way. But thank you for this presentation. It's fantastic.
Yes. Thank you.
Anything else before I close this out? Oh, Dr. Vu, yes, sorry.
Thank you, Melissa. I have 4 questions. And thank you for the presentation. One is, can you talk about, if you can, the evidence to remove the protein subgroups? Second is, can you define nutrient-dense foods? Is it calorie-dense or other nutrients, micronutrients? Third is, do you know if there's any formal recommendation for over-the-counter supplements, medications? And last, and maybe Paul and Deborah can chime in if possible, can you talk a little bit about the anti-inflammatory diet? I myself don't know much about it, but I hear a lot about it.
Sure.
And Melissa, real quick, if you would prefer,
Can
we
go
send
one by
those
one?
in.
Yes.
So that so if you want to just give the answer that you have off the top of your head, that's totally fine. But Dr. Vu, those are great questions. So we can come back to those offline. It's your questions. I just want to make sure you get the right answers the first time.
No, but
and
we
not
can-
put Melissa on the spot for those great detailed questions.
And I was like trying to remember all the questions as you went through. Okay, so overview, I would say for the nutrient-dense ones, I can pretty quickly answer that. Some of the ones on the evidence base, I think it probably would be best if
So
we
let's
could
come
get
back to those.
Yes.
Let's maybe answer the first one, and we can move on.
So for nutrient-dense, it's not just calorically dense. So I think, as others have brought up, we think way beyond calories in nutrition, because there's so many other things our bodies need with regards to micronutrients or fiber, vitamins, mineral, kind of all those different things. So nutrient-dense would be foods that provide either macronutrients or micronutrients that are then also benefiting and essentially serving a purpose in our bodies. So when we just think about calorically dense, while those aren't necessarily always inherently bad, calorically dense often do have higher levels of added sugar, added fat, and added sodium. And again, to your point, Commissioner Geithner, that fat is not necessarily all bad. Like, we do need fat for our bodies to function. There are 3 major macronutrients are protein, carbs, and fat, and we need all 3 of them. So does that answer the question with regards to nutrient density?
Let's just focus on that one, and the other ones we can take online. So, because I myself still don't know what nutrient-dense food is, my patients are going to ask me, Dr. Vu, what do you mean by nutrient-dense food? What kind of, what should I eat? Should I eat a steak, or should I, So, can you get it down to the patient level? What kinds of foods are nutrient-dense?
And I would say nutrient-dense is not necessarily a layman's term or a term we would be using with necessarily everyone, especially for anyone that might have, a lower health literacy or anything like that. But yeah, I would say a food that has components that would serve a purpose for your body. And it's going to depend on the person, right? So like milk, for example, has calcium. That's important for bone health. But also, if I were to tell someone eat more iron, for example, they might not know what foods have iron. So then we would break down what foods have iron, how you can get the iron. So for example, a steak would be a good iron source. Would I want that person only to be eating steak? No, because then they're going to be missing out on, vitamins and minerals that fruits fruits and vegetables offer, the calcium that dairy products offer, and things like that, which is why the nutrition research can be really challenging too, because it's hard to boil things down to, I want to study this one thing and control all other aspects. We deal with humans that have full, really, it's also lifestyle choices too. So yes, I know that can get, and which is why like the nutrition education space, it is hard to cover it in just a quick conversation.
Actually, I apologize. I changed my mind because it's also very important in my mind.
Yep.
Can you talk about the removal of protein groups? I.e., in my mind, when I see that, I interpret that as eating a steak is as healthy as eating a piece of fish. Everything else calorically being equal. Is that true?
So why it was removed, I don't completely know. I would have to go back to the different scientific reviews as to why that decision was made. And I will say as well, sometimes there's not an A to B link between the scientific review and the dietary guidelines. There's kind of lots of other stuff that happens. But yeah, the salmon's going to be providing things like omega-3s and things like that. So the guidelines did mention animal protein and plant-based protein and had kind of that whole list. But it did, in the past guidelines, there was weekly ounce recommendations of different subgroupings. These guidelines did not have that, and I am not fully familiar with the reasoning behind that.
Thank you.
Mm-hmm.
Okay, great. So I'll wrap up with just a comment and a question.
Yeah, sure.
And that's just thank you for all the great comments and questions to you. This is very exciting. I think my understanding is this is a pretty big domino as we think about where you mentioned everything is connected to this, right? What we serve in schools, also what they teach in medical schools, what you provide during WIC appointments. So I'm certainly excited, looking forward to continuing to follow this. So my question, please keep us informed. Tell us what you need. I think one major theme highlighted by Commissioner Nelson was it's really easy to change policy and guidelines, really hard to change the culture. But as a square one, this is a great start. So what do you need from us to enable that, to accelerate that, to ensure that you're successful? Because again, over the last 13 months, I think I've said this is one of the most important things in terms of policy, in my opinion, and how it connects to health, wellness, avoiding, treating, managing chronic disease. So,
yeah, that is a big question.
and no need to answer now,
Yeah.
but it's not a rhetorical question. So just let us know.
Sure. Yes,
Please keep us informed. As you learn more, we can put this on the agenda every month if you want. It's that important.
Yes.
So.
Yeah, I mean, I think overall, I think sometimes, these things come out, there's a lot of excitement, and then lots of other things happen. So, and for us in the nutrition space, we always kind of keep the conversation going because that is, our jobs and what we could talk about all day. So yes, I think just, keeping the momentum going and keeping this, conversation continuing, I think is a really great first step.
Great. Well, we will move on.
Yeah.
Let's be sure to capture Dr. Vu's questions and get him answers. And I think the board would appreciate seeing those answers as well.
Perfect. All right. Well, thank you so much.
Great. Thank you. Okay, let's move on to the Environmental Health Regulation 43 Transfer Title section. Just to introduce this, I think this is a big deal. This is a big topic. We have until June to make a decision, to have action. I will say this is the first of what can be several discussions, so just keep that in mind. This is this topic 101, right? So it is okay, I think, if we don't get into every single detail, answer every single question. Let's use this as an introductory to what we need to start thinking about and what we need to start making sure that we know in order to make the right, best decision. Sound good? Okay.
Perfect.
Kat,
Awesome.
I'll hand it over to you.
Thank you, Hunter. I'm Kat McGarvey, the Environmental Health Division Director. Again, here to talk to you about on-site wastewater treatment systems, which is a frequent topic. To Hunter's point, we do have till June 15th to adopt an amended version of the regulations in alignment with Reg 43. And so I know there's a lot of questions. There's some pretty significant changes, so I wanted to just bring before you the process where we're at and kind of give you a little background and history for consideration before just asking to come before you for a public hearing. So to get into that, just a little history on the on-site wastewater treatment system regulations. The current regulation was effective, had an effective date of July 7th, 2018. So we have not modernized our regulations since 2018. And that modernization at that point in time really focused on performance, accountability, and groundwater protection. And so we've done a lot to move from the idea of put it in the ground and forget about it, and this idea of just disposal to treatment. You know, these systems were never intended to be long-term solutions. They were always intended to be a short-term solution until there was sanitary sewer everywhere. We're not in a position to have sanitary sewer everywhere, nor will we likely ever be, because we have a lot of rural community, we have a lot of small areas that would require substantial infrastructure changes in order to meet that, and that's just not a likely occurrence to happen. So within our regulations, there are 2 sections that are considered opt-in, opt-out from the state level. So the way that these regulations work is the state sets a standard regulation, they set guidelines, they set parameters. We can either adopt the regulation 43 and use that. We can adopt and add to, as long as it is as strict as or more stringent than. But we can't just have our own regulations and have whatever we want. We have to be in alignment with Reg 43. So there are a couple of sections in Reg 43 that are considered opt-in, opt-out. We as a county have opted into those sections since 2014. And those are property sale acceptance documents, which is known as transfer of title in Reg 43. We refer to it as property sale acceptance document to eliminate confusion with our community. The transfer of title really is speaking to the title of the property, not a title that's associated with the septic system itself or the on-site system itself. So we reference property sale acceptance document as the transfer of title program. These requirements are super important. They do protect buyers and the public. It is considered education-based, so we provide a lot of educational awareness so that they can make an informed and educated decision on the purchase of a property. It's no different than a home inspection, really. You want to have your home inspected so you know what you're walking into. These really came around early 2011 to 2014. A lot of properties were being sold and people were buying systems that had failed. And at that point in time, you were talking a $10,000 to $20,000 investment. Today, you're talking a $40,000 plus investment in those systems. Some areas, it's much more. I've seen them as high as $500,000. So, wow. And that can get into commercial areas, but some of the residential systems can be 6-figure plus systems also. So it is really important.
Yes. Councilman Donaldson.
Yeah. Just before we go on, what you said makes sense. Like, hey, there's Regulation 43. We can adopt it as is. We can make our own regulations stricter. We can't make them less strong.
Yep.
But then there's a part where you're saying we can just opt out of certain parts. Doesn't that make it weaker?
Not necessarily, because the state doesn't require us to have those programs. So we can choose to participate in them.
And one of those programs is the
property sale. Yep, transfer of title.
Okay, so currently that's required in El Paso County.
Yep.
We could remove that.
In theory.
But then buyers would buy. When would they be required to make these modifications? Because that's the concern, right? They're buying a property, they won't know that its septic is below. Would it be below state requirements?
It wouldn't be below state requirements because it's opt-in, opt-out. So, and we've been one of the, our program and our regulations are one of the leading programs in the state. And so I will talk a little bit more about that.
Okay. Are there how many of these opt-in, opt-out sections are there to this that we're going to consider?
Really just 2. Just 2.
And this is one of those.
Yeah, this is one of them. Yeah.
Okay. I'll hang on and see what else we got.
Yeah.
Let's get through, because I would love to hear from Mayor Dixon as well. Can you just call out, as we heard, what's opt-in, what's opt-out? Just be very clear on our options, which I think the slides are.
Yes.
But let's go ahead and continue.
So we can opt into, and we already have opted into since 2014 with an implementation date of January 2015. So we've been operating this program since January 2015. And that's the property sale program. And it's super important, and there's a lot of benefit that comes with that. The other opt-in, opt-out program is the operation and maintenance requirements, which are central to the long-term sustainability of systems and in order to protect groundwater, the homeowner's investment, and public health resources. So that is another opt-in, opt-out. But we have opted into both of those currently. And there are implications for opting out. So we oversee one of the largest OWTS programs in the state with more than 35,000 known systems in the county. And there's many more that we likely don't know about, probably in the order of thousands, that predate permitting requirements, which was 1966 is the permitting date. OWTS program supports substantial regulator industry, including over 350 certified inspectors, service providers, and licensed installers, as well as more than 100 system cleaners, and those are your pumper trucks. Regulatory oversight is active and ongoing with more than 800 property sale acceptance document reviews conducted annually. About 20% of those receive a notice of condition, meaning of the 800, 20% of those systems that we review are required to take action to remediate some sort of impact the system is having on the environment. Our operation and maintenance program has oversight of over 700 systems, and that is systems that are installed that meet certain design parameters, including pressure distribution, higher level treatment, and that allows this ongoing operation and maintenance program. The implication here, if we don't do that, is systems such as in Green Mountain Falls may be subject to larger footprints. We may not be able to be creative in solution-based finding without this program. So this program allows us monitoring long-term oversight to be able to be creative in solutions and reduce footprints of these systems by ensuring they remain functioning as intended.
Commissioner Geithner.
Yeah, I understand we want to get through this, so I don't want to belabor. So if you've got this coming up, but I want just a bit of clarification here. So you said 20% of these systems are ones that need some sort of mitigation. Mm-hmm. Does that prevent the sale? Or
No.
they can sell it and the new owner, but it's just making them aware when they purchase it that they have to do that? Okay, that's what I want to know. Thank you.
So they're issued a notice of condition. It says what needs to be corrected. They have 90 days to correct that, but it does not impede the sale of the property. So they can figure out how they want to negotiate that correction. As long as they pull a permit, some of them require permits, some of them don't. So we work with the homeowners and the property owners through that process. The regulations, so this regulation is governed by both state and local level. So that Reg 43, as we stated earlier, is what sets the standard for all counties. There are several counties who just adopt Reg 43 by reference. There are several counties who adopt Reg 43 with some additions and create a local regulation, such as where we fall. And then there are some counties that choose to write regulations that are in alignment with Reg 43 and move through that process as well. Reg 43 was recently updated through a stakeholder process that occurred last year. We were a part of that. We sat through those conversations. We participated in that. So as we participated in that, we knew some of these changes were coming. And so we began educating our industry. We began doing things to review how those changes were going to impact our community. Their effective date was June 15th, 2025. So through statute, we have 1 year from that date to come into compliance with our local regulation. And in order to do that, we have been leading a similar structured update that includes a stakeholder engagement. These will go through our legal team for review. It will go to CDPHE for review prior to us coming to the Board of Health for a public hearing to adopt those changes. Our stakeholder process includes numerous industry members. It includes system cleaners, engineers, designers, licensed installers, service providers. We also have posted each of these sections that we've worked on to our website for public comment as well, so all of our industry members can provide or participate. We've received several comments and feedback that we've incorporated and worked through as well through that group. proposed changes to align with Reg 43. So there's 3 real big ones that are coming. The biggest being the elimination of cesspools. So once a cesspool is identified, it can no longer remain in place and has to come into a conforming system status. There's a lot that goes into that.
Mr. President, can you define what a cesspool is?
I have that.
We do
coming.
have a slide
Yeah.
on that.
Yeah.
Can we wait? Is it good?
Yeah.
Okay, let's continue.
Soil clarifications, we have a variety of soil types in El Paso County. Contrary to popular belief, I did have an engineer tell me that everything in the Pikes Peak Shadow was sand. That is not true. We have rock, we have bedrock, we have groundwater, we have all the things throughout the county, so we have to be cognizant and aware of all of those. And then the addition of disinfection as a treatment option to further reduce footprints as well and treat the effluent prior to being dispersed into our groundwater system. We also locally have some targeted updates to our industry professionals that will improve efficiency and accountability. By eliminating routine system cleaner inspections, so currently we go do inspections. In the 12 years I've been doing this, we've done 1 re-inspection. It just isn't feasible. It's not something that's providing a public health benefit to us, where most other counties just require them to go through a training program and submit their training certification. So we're going to move to align with that. And then also we spend a lot of time with our designers, most specifically our one-off designers who don't really know OWTS. So unfortunately, there's not an OWTS course in college. They might have a chapter in their civil engineering program, but this is just not something that is educated on. And so CPAL does a lot of work around training and designing and soils classifications. And so we're going to push to have our designers participate in that and provide that education. So hopefully we spend less time going back and forth to get the design right with them as well. So in order to move forward, we need to understand what a cesspool is. This is a picture of a cesspool. It, at its essence, is a hole in the ground that is built with cinder blocks, generally speaking, where the solid and liquid all combine and then is just allowed to seep into the ground around us, ground around it. This is really problematic. They tend to be very deep. The deeper you go, the less oxygen there is in the soil, the less treatment capacity there is. And so, again, my favorite quote or my favorite fact is water, once it originates in the mountain springs, makes its way to the ocean, passes through a human body a minimum of 7 times. That's just a human body. That doesn't count anything else. So everything we put back into the ground through waste re-enters our groundwater systems. If we don't treat that, if we're just disposing of it, it can cause long-term implications and public health risk down the road. So if you're downstream and you have a well, you're getting water that has likely been recharged with some sort of wastewater. So we have to be very cognizant about how these things are treated. So cesspools they're not good. However, we can be very creative about how we bring them into conforming status. And we've done a lot of work. So, like I said, we've participated on the stakeholder process through the state, and we've been very intentional as we've gone through our stakeholder process and our regulation revision about evaluating the potential adverse impacts, particularly those related to the cesspools. We've done a lot. We've spent a lot of time in the county. We know areas like Green Mountain Falls, Park Vista, the Broadmoor areas, and those are 2 areas that are within city, within city that you would think, oh, those can't possibly be on on-site wastewater treatment systems. Well, they are, and many of them are on cesspools. So we have a lot of considerations here. They're generally very small lots. I think our land use code now says you have to have a minimum of 2.5 acres to support a septic system in a well. That's just not feasible in a lot of areas, especially that are already built. So we know that we're going to have some struggles. We know that we need to be creative in how we approach this. So in order to do that and mitigate some of the risks, what we've done is advocated at the state level for a variance ability to cesspools. So there is a variance language in the regulation that comes from Reg 43 that does allow the potential for a variance to be heard. That variance would have to come before the Board of Health. The onus is on the property owner to demonstrate the impact and the ability or the inability to put a conforming system in. So we've developed a very clear process and guidelines to help property owners understand that, as well as guide us in what we are and aren't going to be able to hear. So, if a property can support it, it would be really hard for us to support allowing that cesspool to remain because of the public health risk. However, there are properties, specifically in Green Mountain Falls, that you can't drive to, and you have to park down a hill and walk to. There's summer cabins, there's a lot of things, properties up there that are not, it would be near impossible to get equipment up there. And so we have to be able to evaluate potential variance requests for that. And we've developed a document that's been through our stakeholder process. We've had input from our industry and our community on that. That was also posted to our website for comment as well. In addition to that, through the property sale process, we've added some limited exceptions to the property sale process. And so we really mimicked Boulder on this one. Boulder had some of these exceptions in their regulations already, so we pulled from that. And that includes, if it's being transferred within family, immediate family, those don't have to go through the property sale process under this proposal if that's approved. If you're just removing a party to the sale, so for instance, if you're going through a divorce and one person's coming off the property, those don't necessarily, that would be an exception that we're proposing. So we're working through being able to mitigate some of the risk and being able to help us creatively work with property owners to address this as we need to. So that's what I have. Questions? I'm sure there's a lot.
Let me go to Dr. Chan. You've had your hand up. Is that from this discussion or previously? Dr. Chan? Okay, that might be
Sorry, I was muted. So my question is, one I have a question about is the 700 properties that you're currently monitoring. Are those primarily engineered systems?
Yes, they actually all, I guess I won't say all, 99.9% of them are engineered systems, and they include pressure distribution and higher level treatment. So essentially they're like little mini treatment plants on individual properties. Those do all require engineer design.
And so if there's a permitting process in which the system is engineered by an engineer and then installed by a licensed installer, and then you guys have also reviewed the plans, why wouldn't you treat them as a functional system that's going to last the life of their life expectancy?
That's a great question. Permitting and construction doesn't necessarily equate to functionality. And we, through this process of operation and maintenance, when we added pressure distribution back in 2018, so we have one of the most robust programs for operation and maintenance, we identified that several of those systems were within days of backing up into a home or surfacing because of construction-related issues and impacts. And so these systems, because they have mechanical components, those wear out over time. We have to make sure that they function long-term because we've permitted reductions to groundwater. We've permitted reduced footprint sizes, and so that can adversely impact over time. I will also just mention that property owners who have never lived on an on-site wastewater treatment system tend to misuse and abuse their systems, which leads to failure. So we've seen brand new systems go in the ground and fail in 3 months. We've seen brand new systems go in the ground and last for a long time. EPA average lifespan of a system that's well taken care of and with maintenance, operation and maintenance, is about 30 to 40 years.
Okay, so if the system went through the engineering, permitting, installation, inspection, and was functional at the time it was completed, why would they fail in 3 months?
There is so many reasons that could happen. And again, engineers didn't take a class. A lot of them don't take classes specific to this, but there could be misclassified soils. There could be, abuse of the system. There's a lot of reasons that go into that, and it would be highly dependent on each system.
Yeah.
But doesn't public health look at the soils test report and look at the perk test and make sure that all of that is actually accurate before permitting, and then at the time of final inspection, make sure everything is installed correctly?
We do. We don't see the soils per se. We do rely on an engineered stamped soils report that we do verify or look at the soils, but if it's not substantially different, we're not qualified to call out a differentiating factor in a soil. So we have to rely on that. So it can be variable between properties. Also, it's important to note that groundwater's levels fluctuate over the course of years, and some they can be high one year and they can be low next. They might not exist at the time you do the soils report, and then 2 years later they do. So there's a lot of things that impact that and can change over time.
So there's a line. Let's go to Mayor Dixon, and then
What are you wanting from us? That's what I don't feel like I understand. Are you wanting a decision from us at some point? I do want to hear from Mayor Dixon, but there's a lot of just random questions, and so can you give us?
I will address that. So today is informational only. Ask your questions. I will go ahead and get to my question, which would be at the end of this, but I'll do it now. To frame up Commissioner Nelson's question, it would be super helpful to have a slide that says, these are the two things we're voting on. A yes vote means this, impacts Y person, costs Z amount. A no vote, same thing. For vote one, and then I think there's 2 votes, right? There are 2 things we're voting on technically, or could?
So we're not asking for a vote today.
No, I know. This is eventually. So
information.
as a next step from this conversation, in order to get to that point, I think the board needs that. Because today is informational only. I know it's a lot of information, so we're asking a lot of questions, but I think a good next step would be to frame up, given everything we learned today, this is what you need from us, very plainly, visually. I'm a very visual person. Yes, no, impact, cost, and who's impacted. Does that sound good?
Absolutely.
Okay, does that answer your question or your concern? Yeah, again, today, no vote, no decision, just informational only.
Yeah, I just am not even sure what questions I need to be asking to help make. I'm not sure where we're trying to get to.
Okay.
So, thank you.
So Mayor Dixon and then Dr. Vu.
So I did ask for this to be on the agenda, so if you'll indulge me a little bit. I've actually got copies of the regulation in front of me, and these are things to consider. And obviously, the big issue I'm having is with this transfer of title, because the state effectively changed the rules on us. So right now, the transfer of title is optional. It's completely optional. But in addition, you have an option on the types of title that it can be applied to. If you do have an inspection program, according to regulation, and I'm quoting, cesspools must be properly abandoned. So if you have a cesspool, it's got to go. The issue I'm having is we're not handing the property owner any data. So there's no burden of proof being shown here to the property owner. It's just, to me, it's an arbitrary and capricious regulation change. The economic impact, you've seen 35,000 potential cesspools. What we're seeing up where I'm at is probably a minimum of $50,000, which puts it into an economic impact of over $1.75 billion. And that's for the residents of El Paso County who are directly affected. Variance has been mentioned. So the variance request, and I'm quoting here, request must be accompanied by, the important word must, technical justification by a professional engineer or professional geologist which indicates the specific conditions which exist and/or the measures which will be taken that support a finding that the variance will result in no greater risk than that associated with the compliance of requirements with the regulation. So basically, you're asking a licensed professional engineer to say the risk of a cesspool is the same as the risk of a brand-new system. And I say that's, for a professional engineer, that's a non-starter. So I don't think you can get there from here with that requirement. It's a must. And so the variance to me, the whole variance section to me is a joke. So, sorry, personal opinion.
Let's go to Dr. Boot, and then we'll come to you, Commissioner.
But I have
okay.
a couple more things. Again, burden of proof is on the applicant. I wouldn't come to someone and say, let's do away with this without having something else to go in its place. And to me, there are other sections that say if you're within 100 foot of a well, okay, you can't really put in something within 100 foot of a well. There's some distance requirements. To me, we could redefine a failed system as one that we could include, if you have a cesspool that's been shown, very important word, to be contaminating a well within 100 foot, that's considered to be a failed system. And so, yeah, I wouldn't come to the board and say, let's do away with something without having something else in its place. So, okay, I'll get off my soapbox.
Can I just add one point of clarification here? I think it's very important that it's noted that the identification of a cesspool and that going away is not directly tied to the property sale program. It is a standalone section in the regulations that will be required regardless of whether the property sale program is opted into or opted out of. So that section exists separate and different from the property sale program. I just want to make sure that that's a clarifying point.
Okay, so that means you can't put any new ones in, obviously. But if you go to sell, the regulation now says if you have a cesspool, you just got to get rid of it.
Yeah, and so there's always been, for clarity, you've not been allowed to install a cesspool or an arrowhead type system since 2014.
Right.
So those two have already been in the regulation. This specifically states regardless of how the cesspool is identified, whether that's through property sale or failure, or it's just identified at any point in time, it no longer can remain in place. So it is not connected directly to the property sale program.
Actually, I would have to disagree with that because that's not what this says.
There is a piece of the cesspool under the property sale program. It's connected in both areas, but there is a separate area for the cesspools.
So Todd, could we get whatever it is that you're referencing, can we get a copy of that at the board so that'll help us?
Yeah, no problem. You'll see my red ink stuff all over it too. So,
have you two discussed one-on-one outside of this?
Mm-hmm.
Okay, great. Okay, that's what I would hope. Dr. Veal.
Thank you, Kat. I just want to clarify, you had mentioned you wanted to propose that any variance would come to the Board of Health. I'm hoping you mean to come to public health and does not have to come to the level of the board.
The regulations do state that variances have to be heard by the Board of Health. So there are some minor provisions within the regulations that we can work through ourselves. However, substantial variances and all of the variance requirements, even the ones that Mayor Dixon had mentioned, those are already existing in our regulations for other factors as well. So they're just being equitably applied to this scenario as also.
Wow, thank you. Mayor Dixon, can I ask, did you say that any variance must be accompanied by professional engineer and professional geologist?
One or the other. It has to have technical justification from a professional engineer or a geologist.
Oh, so it's or one or the other. Perfect. The last time I looked for a professional geologist several years ago, there were less than 5 in Colorado.
Commissioner Geithner, and then we'll go to Councilman Donaldson.
Yeah, I think this is a really important discussion, and it's very nuanced, even as we're hearing about trying to understand all of the various legal and policy pieces around this, particularly around the idea of, like, I have lots of questions about the variance, and I'm glad that you read that, because that's a very onerous requirement for someone seeking a variance, because my question was going to be, is there any kind of economic or hardship, potential to consider hardship in this? Because a family who owns one of these and it's identified, now you have to get rid of it and you have to spend $100,000. That's just not possible. So I guess, with all of that being said, I personally believe we need an executive session on this with legal to talk through all and ask all of these legal questions about what we can do, what we can't do, and explore. I really appreciate the work that Kat is doing. I obviously think that she should be there, but I think we need direct access to talk to the attorneys about what, and get all those questions answered.
I think that's a great idea.
In our next meeting.
Yeah.
Okay. Councilman Dahl, who had their hand up? Was he? Okay, yeah, go ahead.
So Kat, my understanding of what you're saying is that regardless of sale, if one of these is identified, a septic, not a septic, but a cesspool, it can no longer remain in place. Per the regulation, how long does the property owner have to replace it?
So generally speaking, if it's through the property sale process, there's a 90-day time frame for them to take some sort of action. Typically, it's going to require, in this case, to mitigate a cesspool, it will likely require some form of a permit. In general, the way we operate under that is once they pull the permit, that's an action that they've taken within 90 days. That permit is valid for a year, so that then gives them a year to come into compliance with that.
Oh, so they have a year once they...
Generally, once they pull a permit, yes. Yeah.
But what I'm trying to understand is whether I own a property, there's a cesspool on it, I'm not going to sell the property. But if it's identified, who identifies it, and then that starts the clock for the year, or for,
yeah, so,
how does that work?
Yeah, that's a good question. So typically, it would be through failure. Is how outside of property sale is how that would be identified. Well, let me be clear. We're not going to go around to properties and knock on doors to find cesspools. We permit over 600 systems a year. Like we have more than enough to do without opening that can of worms. So really, would be through property sale and or failure of a system if and when those fail. And we've dealt with a lot of failures in the Green Mountain Falls area and Chipeta Park just because those systems were never intended to be used year-round the way that they are. However, this is the position that we're in. And the regulations and statutes say if you don't have a functioning septic system or means of waste disposal, you cannot inhabit that property. So we have to be creative, and we've always done that. We've always tried to work with the community, and really it comes down to communication. If they're in communication with us, we're going to work with them through that. Numerous times people have gone through a property sale, have to repair their system, but they need the sale of the home in order to be able to do that. So we will, as long as they're communicating with us, we're going to work with them in order to achieve that compliance.
In failure, the way that's used, what that means is they flush the toilet, they run their sink, but it's backing up. Is that the typical way of failure?
Failure is defined as, in Reg 43, as either backing up into the home or structure or surfacing.
Okay.
Yeah.
But I guess what I'm trying to figure out is you're saying that, hey, regardless of, the home could still be sold, right? This doesn't stop a sale. It's just the new owner would then have the responsibility to replace it because it's now been identified.
Yeah.
Is that right? And they would have kind of a max of a year.
Yeah, so they can
roughly.
Negotiate who's going to do what and how that's going to work. Generally,
Yeah.
what we see happen is they put money into escrow and the new owner takes ownership of going through the process with the money in escrow. I just talked to a homeowner last week that bought a home that never went through this process, and now that system is in failure 3 months later. And that new homeowner now has the burden of all of the cost of this, and now it's not a shared burden. And that's really what this is intended to do, is to provide educational disclosure so that the community can make informed and educated decisions around that, so they know what they're walking into and or potentially, taking on.
And my final question is, how many cesspools do we think there are in El Paso County?
I would imagine all of the systems that we don't know about that exist are likely on cesspools because they predate permitting requirements. So anything, you're talking 1970s and earlier, anything that was built at that time that has not yet had a repair is likely on a cesspool. I don't have an accurate number. I don't have a way to get that.
Do we have a GIS map or something of all the properties that are on septic systems? They're not on? Like,
We currently
CSU
do
water?
not, but it is something that we are working towards making and identifying.
Okay, thanks.
Let's go to Dr. Chan online and then Dr. Vu, and then I think we can wrap up. And Commissioner Nelson.
Okay, so for the systems that you have seen fail, were they primarily systems that were initially intended for part-time, seasonal use that were then converted to full-time occupancy? Or are they being used as, commercial purposes like an Airbnb, in which many more people occupied the residence than it was initially intended for? Or what are you primarily seeing?
So we don't keep data on the why the system has failed because that's not something that we generally collect. In broad general sense, I can tell you that most systems that fail are through overuse of the system. Soil's only able to accept so much liquid, water, effluent, whatever you want to call it, before it saturates and becomes unusable. Continued use, through rest, it can recover and it can then again accept that, but through continued use and overuse, that generally is what leads to failure. But there's so many reasons for failure and we don't track the why. If it's failed, we want it repaired, we want to be in compliance and work with the property owners to do that.
Well, I'm seeing yet another issue to discuss. One, of course, is the transfer of title, whether it's within a family or to another party. Somebody is still assuming ownership. And I do know, I've had neighbors who've been installing systems and they're 50,000 at a minimum, and a couple of them are paying over 100,000. And I just don't think that it's feasible for somebody who is in a home and has to, say, remove their cesspool and then put in an engineered system. What is their option? Are they going to have to abandon their house? So I think that in my mind, it sort of comes down to use. I think that if somebody is going to convert their home into an income stream, maybe we should take a little closer look at what the waste system is. But in terms of inspections for a transfer of title, I understand why this came up, but I also understand why the state commission made an exception and left it up to local authorities, because it seems like it would be no different than any other system within the house, like the roof or fireplace or plumbing. I understand that there is a public health implication to septic systems, but I think the same can be said for a fireplace. There's always the risk that an underperforming fireplace could cause a fire. So I think that there's, several things to consider here, but mainly to Mayor Dixon's point, I don't think that Green Mountain Falls can pay over $1 billion to mitigate all of these systems.
So, and I appreciate that, Dr. Chan. I think we should, I think an executive session and more education would be ideal here. And I'm happy to answer any questions because, and this is what we run into a lot, is the education around on-site wastewater treatment systems and septic systems is so lacking even within our community members that the implications of those, to be compared to a fireplace and the fact that there could be a fire, that we're not talking apples to apples here, we're really talking apples to oranges, and that there is a substantial difference, where a fireplace and a structure fire may impact that structure and maybe the neighboring ones, a failing septic system adversely impacts the entire community and the surrounding community from that system. And so, the OWTS tours that I took several board members on, that we went to 3 different systems that were failing, and I've been through systems in Green Mountain Falls that have failed, and you've just got sewage running down streets and running down alleys and properties and kids playing in it and running through it and pets and animals. And so the exposure to the harmful bacteria, viruses that come from wastewater is much different than some of the simple home systems we're talking about. We've been to Green Mountain Falls. We've talked through their town meeting. We've been to several realtor groups. We talk to realtor groups all the time. We provide realtor education a lot, and it's still not enough. We rely on our industry partners to help with some of that, and we've come a very, very long way. But there's still more to be done, and that's just very clear, and that's part of what we wanted to do. So to Commissioner Nelson's point, today was an identification of we need a lot of education before I come to you in April/May for a public hearing to approve an amended version of the regulation. So the intent, to Hunter's point, and we can certainly bring more information to the board with this is step 1 in providing some education. So you guys can sit with it, you can wrap your brains around it, ask me all the questions you want. More than happy to answer those. And then we'll send our regulation to Lori for review. We'll get it to the state because the state needs it for 30 days. And then we will schedule a public hearing with the board. And at that point, we'll ask the board to vote on the regulation as we have it written.
Thank you, Dave. I want to say I agree with you in terms of cesspool failure. If we're going to propose to eliminate all cesspool because of environmental concern, then by definition, if you have a cesspool, it's a failure already. And I think that it will be difficult for us to put in a system, a regulation to eliminate cesspools and then not being able to track and enforce to, which cesspool should be eliminated, or only go after people who sell their house or if their cesspools fail. So
I do think just one other point is there is not money in the on-site wastewater industry, right? There's not, and so homeowners really are, they buy a property in general with a system, septic system or an on-site system because they don't have a wastewater bill. But then when it fails and they have to repair it, it's right. The cost at the time of repair ends up being what you would pay for a sewer bill, but there isn't. And we've done a lot of work through CPAL. I am currently I am the president of the Colorado Professional and On-Site Wastewater Association for this year, and we do a lot of advocation at the state and at the government level to try to advocate for funds the same way that municipalities get funds. There just isn't. There's not a lot of takers on that.
Correct. So, but how can we tell the seller to get rid of their cesspool when they can point to the neighbor who's not selling their house that has a cesspool in their backyard?
Something we deal with all the time. I mean, unfortunately, when you're a homeowner, some of those things come with the territory of being a homeowner.
Right. But, if we put in a system that we only go after certain people where if our regulation is all cesspools need to be eliminated, and we only go after a subset, right? So we need to be careful what our regulation is.
Okay, so here's what we're going to do. We're going to go to Commissioner Nelson and then Commissioner Geithner and then Lori. I'm going to ask you to try to wrap us up by framing up the next discussion, which is a reiteration of this wonderful presentation. Kat, thank you. Obviously, we're not all experts, except Mayor Dixon, of just, given what we've heard, this is what we're going to be deciding on by June, and we will plan to have an executive session next month where we can continue this discussion. We can have all the appropriate people. You can be in there to help lead it and go from there. How does that sound? Okay, great. Commissioner Nelson.
That sounds great. That's what I'm needing. I still don't understand where our choices are in this.
Yep.
Like with the cesspool thing, is that the state is already saying we have to do this, or do we get a choice in it? So I just need clarity on what our options are and what you're asking of us. I know not today, but and then while we're at it, just for in that next conversation, I would like to understand where the 2.5 acre requirement is coming from. I know I've mentioned this before. Is it our own requirement, or is that also already in state regulation? So if you could just be prepared to have that
absolutely.
for us next time.
Yep.
Thanks.
Thank you. Commissioner Geithner?
Yeah, and I'm going to make this really quick too, because I think really what we're getting at is all the same things here, and why I think that executive session will be really important, because what I heard was that cesspools have already been outlawed by the state. And so we're not deciding about whether people get to keep their cesspools.
Right.
And so there's very specific things that we will have the ability to act on. And since this is something that I feel like commissioners deal with constantly, and then we want to be really angry at the state because we disagree and we think that they're causing a lot of hardships, the reality is maybe we can get to some creative solutions around that, and maybe we can't. I think these are both really important topics. I agree. We don't want this stuff running down. At the same point, we can't strap families with these things. I know Dr. Chan's mentioning, you know, how they're using the home. Not sure that that's legal. You know, people have property rights, and so there's so many angles here that I know that I think legal. I hope you're ready. And I really think that, like, we all have to get our mind around the question that Commissioner Nelson is asking, which is, what are our legal abilities in this situation, and understanding what the state has already taken off the table. And once those things are taken off the table, are there any mitigations, like through that variance process? It sounds like it's pretty prescriptive, and we won't have a whole lot, because I wouldn't want to see an economic hardship type situation. Not when there's failure, but if it's identified through something where, you know, additional checks and inspections in a situation like that, or something like, I would love to see that. But whether or not that's legally allowable, it sounds like maybe it's not. But I think we have to get to those very hard legal questions from a policy perspective before we can really get to this. And I really am grateful that we are starting this very early.
And that is why we'll have our session next time. So Lori, do you want, or Mrs. Ralston, yes?
Could we get a copy of that regulation and then maybe sections highlighted? Maybe that's what you have, Mayor Dixon, I don't know. If that's what that is, that would be really helpful.
Okay, thank you. So Lori, do you want to just give us a little preview for next time on exactly the question we're being asked to weigh in on?
I'm not sure. I'm sorry. I'm not sure what you're looking for. So in terms of executive session, what I would anticipate bringing to you, unless otherwise directed, are to clarify the portions of the regulation that are optional for the county to adopt or not, and then to explore what we could do within those options. Is that what you're looking for?
Yes.
Okay, then.
I just have a question for
Go
the
ahead.
attorney. Does that need to be done in executive session, or is it even an appropriate use of executive session? Like, to what you just said, seems like that's what we've been talking about and can be discussed, openly.
If you are seeking legal advice from me about the answers to those questions, then that can be done in executive session. Okay. If you want to have a broader policy discussion about which of, what makes sense and what doesn't, and what you might be leaning towards, that would be more appropriate for a public discussion. But if you're seeking legal advice, and we can have discussion within that,
yeah.
But if you're seeking legal advice about what your legal options are in terms of what the state is requiring and what the state is allowing as options, then that can be done in executive session.
Okay, thank you.
Okay, great. So in preparation for that, we will get together like we normally do for the agenda, but we will ensure that everyone has what they need going into that meeting. Okay, great. Kat, thank you.
Absolutely.
Was that all from you?
Yeah, absolutely.
Okay. Okay. Yes, March. Okay, so the next item on the agenda is to discuss and ideally vote on the date change for the March meeting. The reason is very simple. That week is spring break for most, if not all, of the school districts in El Paso County. That impacts the board members who have school-age children, and are out that week, as well as staff who need to prepare for these meetings and attend. So it has been proposed and discussed that we move the date up 1 week. So that's number one. Two, there was a group poll that went out that provided some options. Thank you all for your input and for voting. And I believe as of going into this meeting, the ideal change would be on, again, the previous Wednesday, so just 1 week up on March 18th at 8:30 in the morning. So same place, same time, 1 week earlier. So are there any questions before I would ask for a motion to move that up? Again, this is just a logistical question, a bit of a courtesy for all involved to just better align with what's going on in the county as it pertains to schools and spring break. So does the board have any question? Commissioner Nelson, yes.
Since filling out that survey, now Commissioner Geithner and I are going to be traveling that day, so we will be online.
Okay.
And try to still participate and attend, before we're on a plane. We'll arrange our trip so that we can do so.
Okay.
But we haven't booked flights yet. If we're able to be in person and then go to the airport, we will. But just for your awareness that we're still figuring out this trip, and we filled out our survey, or I did, and then learned of this trip. So
yeah, long story of why exactly that all is, but it is a work trip that we have to go on this specific day because of the Hill visits that we're doing in DC. So we really didn't. We knew this was coming, but we just were in that place. But yes, we're really hoping to try and schedule our flight. We do have to fly out that same day, but schedule it to the very best of our ability to continue to make that work. But online at the very least, I think.
Okay, thank you for that. I know this first time, maybe we'll set a new precedent, hopefully going forward. So the first time will be the hardest, most complicated, obviously. So thank you for that. We'll be very thoughtful about the agenda. You're welcome. So any more discussion before entertaining a motion to officially move the March meeting to the 18th? Oh, go ahead. Yes, Commissioner
Just
Geithner.
a quick question, because I know that our staff got questions about the timing of that meeting. Are we looking at the earliest morning time still at this point?
At 8:30, yes.
Okay, thank you.
And then,
well, hold on. So that's a good point. Would moving it up 30 minutes help? Because if you're going to be online either way, we probably would want to keep it to what we asked people, what they voted on.
I don't have an answer because we haven't booked a flight.
Okay.
And so that's the part that we're still working on. If I know 1 o'clock was one of those options, and that would obviously make it difficult. So the earliest time at 8:30 is going to be the best for us.
It was either 8:30 or 9:30.
Okay.
Based on the voting. Yeah, and 8:30 is the leading. Okay, Commissioner Donaldson.
Just for future reference, that Wednesday, the third Wednesday of the month, is always Colorado Springs Utilities Board of Directors meeting, which is in the afternoon. So the afternoon, whoever's from council could never make it.
Okay.
And the MAC often, has something scheduled that morning, which I can just miss. But we would end at, are we going to have an executive session and run long that day, or what time's the end time?
It depends. The goal is 10:30.
Okay, thanks.
Yeah. Okay.
Right. I move to adopt the March meeting to be moved to March 18th at 8:30.
Second.
Vice President Salt moved, seconded by Commissioner Geithner. All those in favor of moving the currently scheduled March board meeting to March 18th at 8:30 in the morning, say aye.
Aye.
Aye. All those opposed? Okay, motion passes. Thank you all. Okay, we will now move into our last item, executive session, to discuss our Fountain property.
Thank you. I'll read the item into the record, and then we need a motion, a second, and an individual vote to ensure that we have a 2/3 a two-thirds affirmative vote to go into executive session. So the request would be to hold an executive session pursuant to CRS 24-64024A for the purpose of discussing the potential sale of public health property at 6436 US Highway 8587, Fountain, Colorado 80817. So then we would need, please, a motion to go into executive session for that purpose.
Is there a motion?
Mayor Dixon also move.
Thank you. Second.
Second.
Vice President Salt has seconded it. So now I will read the roll call, and you can vote yes or no. I'll go last. So Vice President Salt,
Yes.
Commissioner Geithner,
Aye.
Commissioner Nelson,
Aye.
Mayor Dixon,
Aye.
Councilman Donaldson,
Aye.
Dr. Chan,
Yes.
Mrs. Ralston,
Aye.
Dr. Vu,
Aye.
and I vote yes. So that is unanimous, and we will move into executive session.
And we do need perhaps a 5-minute recess
Yes.
to get set up for that.
5-minute recess. Thank you.
Thank you.